Okay, so Bachit, this starts us with our next topic in general pathology, that is neoplasia. Neoplasia, and an extremely important topic. I mean, absolutely no doubt about it. Numerous questions come from this. So let us start with our extreme basic terms in neoplasia. What is neoplasia? In neoplasia का मतलब क्या है? Neoplasia होता क्या है? It is a mass of tissue. Neoplasia, which is this is a mass of tissue. This is a mass of tissue, growth of which exceeds. It is a mass of tissue, growth of which exceeds and is uncoordinated, and is uncoordinated with normal, and is uncoordinated sorry and is uncoordinated with normal tissue. That is neoplasia. Tumor है ना? Neoplasia is nothing other than a tumor. Tumor है. So it is a mass of tissue, growth of which exceeds and is uncoordinated with normal tissue. मतलब बहुत ज़्यादा grow हो रहा है. Next point. Let us have a look at few basic terms of neoplasia. The first basic term of neoplasia is hematoma. Hematoma. This is a disorganized benign mass. Hematoma. इसका क्या मतलब है? It is a disorganized, benign है कि malignant? Benign. It is a disorganized benign mass, which is present indigenous to the site. which is present indigenous to the site, What does this mean? Let us take an example of hematoma. One of the main examples of hematoma is bile duct hematoma. Example, bile duct. Hematoma. मतलब देखो, normally bile ducts are present in portal tract. Normally in all of us, in our liver, we have portal tracts जिसके अंदर bile ducts are present in an organized manner. Suppose bile ducts, instead of being organized in portal tract, if they are present randomly disorganized in the liver, it is benign. It is a benign disorganized mass present indigenous to the site. है तो liver में ही ना. Normally also they are in liver. After being disorganized, they are in liver only. So it is a hematoma. Bile duct hematoma, disorganized mass indigenous to the site is hematoma. Versus choriostoma. देखो बहुत कॉमनली इन दोनों टर्म्स में डिफरेंस पूछा जाता है. वर्सेस कोरियोस्टोमा. द नेम टेल्स यू एवरीथिंग. चोरी करके it has gone to another site. Choriostoma, that is, it is a heterotopic rest of cells. It is a heterotopic rest of cells. Example, presence of pancreatic tissue in stomach. Example, pancreatic tissue in stomach. देखो, let us hypothetically assume pancreatic tissue तो pancreas में होना चाहिए ना. If it is present abnormally in the stomach, if pancreatic tissue is present in stomach, that is called as choriostoma. चोरी कर it has gone to another site. So heterotopic rest of cells is called as choriostoma. It is called as choriostoma. Next general term associated with neoplasia is dysplasia. Next is dysplasia. What do we mean by dysplasia? Dysplasia, this is disordered growth of cells. Dysplasia, this is disordered growth. Of cells. So, इसका मतलब क्या है? What are the features of dysplasia? Dysplasia, which is dysplastic cells, they show nuclear polymorphism. They show nuclear polymorphism. Nuclear polymorphism means some nuclei are small, some are large. Nuclear polymorphism. There is variation in size of the nucleus. It is associated with nuclear polymorphism. High NC ratio, high nucleocytoplasmic ratio, high NC ratio, high nucleocytoplasmic ratio, meaning nucleus is large, cytoplasm is less. न्यूक्लियोसाइटोप्लाज्मिक रेशियो बढ़ गई है. हाउ डू वी नो कि NC रेशियो इज इंक्रीज्ड? What is the normal NC ratio? Normal NC ratio is 1:4 to 1:6, meaning one part of nucleus, 4 to 6 parts of cytoplasm. Normally, nucleus एक part होता है, nucleus is one part, 4 to 6 times the nucleus is the cytoplasm. So normal NC ratio is 1:4 to 1:6. In dysplasia, nucleocytoplasmic ratio increases. Nucleus is large, cytoplasm is less. Next, it is also associated with the presence of hyperchromatic irregular nucleus. Hyperchromatic irregular nucleus. देखो, all these are the features of dysplasia. The cells, they have an abnormal morphology. Nucleus is hyperchromatic, it is more black and has an irregular borders. Hyperchromatic irregular nucleus with increased mitosis. Next point, dysplastic cells, they show a loss of nuclear polarity. They show a loss of nuclear polarity. Meaning, normally, let us assume कि columnar cells है. Suppose columnar cells are present. Normally, columnar cells, they have nuclei on the same side of the cell. That means nuclear polarity is maintained. Versus in dysplasia, it is associated with loss of nuclear polarity. Nuclear polarity is not maintained. It is associated with loss of nuclear polarity. Next, whatever we have written till now, whichever features of dysplasia we have written, ये तो बहुत ही obvious थे. They show high nucleocytoplasmic ratio, nuclear polymorphism, hyperchromatic irregular nucleus and loss of nuclear polarity. मान लिया, agreed. The point which is asked in MCQ with respect to dysplasia is dysplasia lacks invasion. Is it invasive or non-invasive? It is non-invasive in nature. Dysplasia lacks invasion. Very, very important. Next point, full thickness dysplasia. Next point, full thickness dysplasia. Full thickness dysplasia is called as carcinoma in situ. Full thickness dysplasia, meaning involving all the layers of the epithelium. Full thickness dysplasia is called as carcinoma in situ. It is called as carcinoma in situ. What does this mean? इसका मतलब क्या है? देखो, let us assume that this is the stratified squamous epithelium of the ectocervix. Ectocervix, what is the lining? Stratified squamous epithelium. This is the stratified squamous epithelium. Stratified squamous epithelium of the ectocervix with nuclei and basement membrane. This is normal. Now suppose there is dysplasia in upper one third. CIN1, carcinoma, that is cervical intraepithelial neoplasia 1. Dysplasia in upper one third. Forget CIN, dysplasia in upper one third. Or it can be dysplasia in upper two third. Or it can be full thickness dysplasia. Full thickness dysplasia means the whole thickness of stratified squamous epithelium is involved. Full thickness is involved. Full thickness dysplasia, that is called as carcinoma in situ. What is the difference between carcinoma in situ and carcinomas? इसमें and carcinoma में फर्क क्या है? In carcinoma in situ, basement membrane is intact. Very, very important. Basement membrane is intact. You're able to make out that this is the basement membrane is intact. Versus in carcinomas, the tumor cells, they breach the basement membrane and invasion is seen. So in carcinomas, basement membrane is breached. Next point. Now let us have a look at another term with respect to carcinomas, that is differentiation. Before I go to differentiation, have a look at this microscopic image. What is the diagnosis in this case? You have seen this. We know this. What do we see here? On left hand side, we are able to make out that this is the normal stratified squamous epithelium.